After turning 60, there's something most people never hear from their doctors. Some medical tests we've been told are essential might actually do more harm than good. Too often, older adults go through screenings that bring more worry, false alarms, or unnecessary treatments than real benefits. It's not about refusing care, it's about knowing when more medicine doesn't mean better health. I'm Dr. Susan Hayes, a specialist in senior health and longevity, and today we're uncovering the truth about which medical tests truly help and which ones you might be better off skipping. It's time to look closely at what the research truly says, even if it's not a popular topic within the medical community, because these tests bring in billions of dollars every year. When we understand the real data behind routine screening for people over 70, we not only avoid unnecessary medical procedures, but also reduce the risk of serious complications and focus instead on what truly improves longevity and quality of life. So, welcome back to this space where care for the patient matters more than profit, and where medical decisions are guided by evidence, not by habit or financial gain. Whether you're approaching 70, already beyond it, or caring for aging parents, the information we'll cover today could genuinely help protect your health or the health of someone you love. After nearly 3 decades in geriatric medicine, I've seen a difficult truth. There are 3 tests that doctors commonly recommend to patients over 70, claiming they are vital for preventive care. But in reality, major medical organizations have quietly changed their guidelines, acknowledging that these screenings often lead to overdiagnosis, overtreatment, and sometimes serious side effects, especially in older adults who might have lived longer, healthier lives if those tests had never been done. Now, let's talk about a situation I see all the time in my practice, one that always troubles me because I know what might happen next. A patient comes in and says, "Doctor, I'm 73. I feel wonderful. I'm active, with no symptoms at all. But my physician insists I need a colonoscopy, cancer screenings, and heart stress tests because they're mandatory for my age. Yet I've heard about seniors who had complications afterward. I'm confused. Do I really need these tests? Or is there something my doctor hasn't told me about the risks and benefits at my age?" This is the question I hear so often from healthy older adults, people who sense deep down that something about this push for aggressive testing doesn't feel right when their bodies are telling them they're doing just fine. This question often comes up when families are trying to protect their aging loved ones from unnecessary medical procedures. It reflects a growing awareness that, after a certain age, more medical care doesn't always mean better care, especially beyond 70. I encourage you to stay with me through this entire discussion, because by the end, you'll have information that could protect you or someone you love from procedures that modern research increasingly shows may cause more harm than good in healthy older adults. By understanding these facts, you may even add more quality years to your life simply by avoiding complications from tests that were never truly needed. Now, let's talk about a medical reality that few doctors discuss openly with their senior patients. Screening tests are created for age groups where the expected benefits clearly outweigh the potential risks. But once we pass 70, that equation changes dramatically. Life expectancy, the natural speed of disease development, and how well your body can handle medical procedures. All of these factors shift in fundamental ways. And as with all areas of senior medicine, understanding the subtle balance between risks, benefits, and individual circumstances is absolutely essential. Standardized screening schedules made for people in their 50s can actually become harmful when applied to healthy adults in their 70s. Yet many physicians continue ordering these tests out of habit, often without taking the time to discuss whether they'll truly help you live longer or feel better. So, let's step back and look at the core medical questions. What are the 3 tests that are routinely labeled mandatory after age 70? Why is the medical evidence now challenging their value for healthy seniors? What risks are often downplayed or overlooked? And most importantly, how can you have an open, informed conversation with your doctor about whether these tests are right for you or whether saying no might actually be the wiser and healthier choice? Let's begin with the first one, the test I most often advise healthy adults over 70 to reconsider. Test number 1, routine colonoscopy screening after age 75. This procedure causes more complications in older patients than almost any other routine test, while offering very little benefit for those who've already had normal results in the past. The U.S. Preventive Services Task Force now clearly recommends against routine colonoscopy screening after 75 for individuals with a clean history. So, why is it still pushed so aggressively? Because colonoscopies are highly profitable? Each procedure brings in between $3,000 and $5,000 in revenue for the medical system. That financial incentive leads many gastroenterologists to keep recommending them even when the scientific evidence says they shouldn't. The hidden risks they rarely mention. After turning 70, the likelihood of experiencing serious complications from a colonoscopy rises sharply. For older adults, bowel perforation happens in about 1 out of every 300 procedures, compared to 1 in 1,000 for younger patients, and it often requires emergency surgery. The sedatives used during the procedure also increase the risk of heart and circulation problems. Even the bowel preparation beforehand can be risky, sometimes causing severe dehydration or electrolyte imbalances that may trigger heart rhythm issues or even falls. Now, let's look at what the research actually shows. A landmark study published in JAMA Internal Medicine tracked 50,000 adults over 75 for 10 years. Those who continued routine colonoscopy screenings did not have lower death rates from colon cancer compared to those who stopped testing. However, they did experience significantly higher rates of hospitalizations due to complications from the procedures themselves. Here's the medical reality. Colon cancer tends to grow very slowly. If you're 75 and had a normal colonoscopy at 65, any new polyp that might form would typically take 10 to 15 years to become dangerous. Statistically, you're far more likely to face heart disease, stroke, or other health conditions long before that slow-growing polyp could ever pose a real threat to your life. Meanwhile, the colonoscopy itself carries immediate and very real risks. There's one exception: if you're having symptoms such as bleeding, unexplained changes in bowel habits, or unexpected weight loss, then a diagnostic colonoscopy can be appropriate. But when you feel healthy, continuing with routine screenings after 75 is something that growing evidence advises against. Now, let's move to the second commonly pushed test, aggressive prostate cancer screening with PSA tests after age 70. This one is perhaps the most debated of all, because we now have clear data showing that PSA testing often leads to widespread overdiagnosis and overtreatment of cancers that would never have caused harm. So why do many doctors still recommend it? Because PSA tests are simple, quick, and frequently lead to follow-up procedures such as biopsies, surgeries, and radiation, all of which generate substantial revenue. It's become so routine that many physicians order it automatically without truly discussing whether it's beneficial for their older patients. Here's the hidden truth about prostate cancer. Most men over 70 have at least some cancer cells in the prostate. Autopsy studies reveal that 60 to 70% of men who passed away from unrelated causes had prostate cancer they never knew about because it grew so slowly that it never produced any symptoms or affected their health. These are cancers that would never have posed any real threat to a man's life. Here's what the research truly shows. A large European randomized study on prostate cancer screening followed 162,000 men for 13 years. For men over 70, PSA testing did not lower the risk of dying from prostate cancer. Instead, it resulted in a surge of biopsies, surgeries, and radiation treatments, all of which carry serious side effects, such as incontinence and impotence. And here's the part that most people aren't told. When you take a PSA test after 70 and the result comes back elevated, you'll often be urged to have a prostate biopsy. That procedure carries a 2 to 3% risk of severe, even life-threatening infection, a risk that is much higher in older men. If the biopsy detects cancer, which it frequently does because prostate cancer is so common at that age, the next step is usually pressure to undergo treatment. But in many cases, that treatment targets a cancer that would never have caused harm during the rest of the person's life. I've seen the devastating consequences of this pattern far too many times. Dozens of otherwise healthy 75-year-old men who felt fine, took a PSA test, discovered cancer, went through surgery or radiation, and ended up living with permanent incontinence and sexual dysfunction, all to treat a cancer that would never have affected them in their remaining 10 to 15 years. The current medical consensus is clear. The American Cancer Society, the U.S. Preventive Services Task Force, and the American Urological Association all advise against routine PSA screening after age 70 unless there's a strong family history or concerning symptoms. Now, let's move on to the third commonly pushed test: aggressive cardiac stress testing in seniors without symptoms. This is the test doctors often use to evaluate heart health, even when there's no chest pain, shortness of breath, or other warning signs. It sounds reasonable, even cautious, but for healthy older adults, it can start a dangerous chain of unnecessary procedures. So, why is it still recommended so frequently? Because stress tests often lead to profitable follow-ups, like cardiac catheterizations, stents, or bypass surgeries procedures that can generate hundreds of thousands of dollars in revenue. Cardiologists have strong financial incentives to find something wrong that appears to justify an intervention. And the hidden dangers are significant. The stress test itself can actually provoke a heart attack in some elderly patients because it literally pushes the heart to its maximum limit. False positives are also extremely common. Nearly 40 to 50% of abnormal stress test results in older adults show no real problem when double-checked through catheterization. Yet, these misleading results can still lead to invasive, unnecessary procedures that carry very real risks. According to what the research truly reveals, a major study published in JAMA Cardiology followed over 10,000 older adults who showed no signs of heart disease. It found that those who underwent routine stress testing did not have better heart outcomes compared to those who didn't. Yet they faced much higher rates of complications from the follow-up procedures that those tests often triggered. Here's how this usually unfolds. Imagine you're 73, feeling perfectly fine. You take a stress test just to be safe. The results come back showing something slightly abnormal. You're quickly referred for a cardiac catheterization. They discover a 40% blockage, something that likely would never have caused you any trouble. But to be cautious, a stent is placed. Now you're on blood thinners for life, increasing your risk of bleeding, all because of a screening test you probably never needed. That's the medical reality. If you're having symptoms, chest pain, shortness of breath, or unusual fatigue, then a stress test can absolutely serve as an important diagnostic tool. But for older adults who are otherwise healthy and symptom-free, these screenings often lead to overdiagnosis of conditions that don't require treatment, while exposing you to serious risks from unnecessary procedures. Let me share one real-life story that ties these issues together. Margaret, a 76-year-old patient, came to see me. She was vibrant, active, and symptom-free. Her previous doctor had scheduled her for a colonoscopy, a PSA test for her husband, and a cardiac stress test, calling all of them mandatory preventive care. I sat down with them and reviewed the evidence. At their age, with no symptoms and normal prior screenings, these tests were far more likely to uncover issues that could lead to risky interventions rather than help extend their healthy years. So, they chose a different approach. They declined all 3 tests and focused instead on what truly supports longevity after 70. Daily walking, twice-weekly strength training, a Mediterranean-style diet, meaningful social connections, and consistent management of blood pressure and cholesterol with medication when needed. 5 years later, at 81, Margaret remains active, healthy, and full of life. Meanwhile, 3 of her friends who went through those so-called mandatory tests faced serious complications. One was hospitalized after a colonoscopy perforation, another developed lifelong incontinence following prostate cancer treatment, and a third ended up on long-term blood thinners after receiving an unnecessary stent. Her story isn't an exception, it's part of a pattern I've witnessed countless times. Older adults who choose to skip overly aggressive screenings often end up living longer, healthier, and more comfortable lives than those who undergo every test recommended to them. The scientific evidence backs this up. First, a large analysis published in JAMA Internal Medicine found that for adults over 75 with no symptoms and prior normal results, routine colonoscopies, PSA tests, and heart screenings did not lower mortality rates, but they did increase complications related to these procedures. Second, the Choosing Wisely campaign, endorsed by dozens of medical specialty societies, clearly advises against such screening tests in healthy older adults without symptoms. They classify these as low-value care, meaning they waste resources and can do more harm than good. Third, international data tell the same story. Countries that take a less aggressive approach to screening older adults, like the UK, report health outcomes for seniors that are equal to or even better than those in the U.S., where testing is far more common. Before agreeing to any screening test after 70, here are 4 essential questions to ask your doctor. First, given your age and current health, what is the real likelihood that this test will find something that could truly threaten your life in your remaining years? Doctors rarely explain this clearly. Second, what are the exact risks of complications from the test itself and from any follow-up procedures it might trigger? Ask for actual numbers, not general reassurances. Third, if the test does find something, would that information truly change your treatment in a way that improves your quality or length of life? In many cases, the honest answer is no. And fourth, what do major medical organizations currently recommend for people your age regarding this test? Many physicians still overlook updated guidelines that advise against routine screening in older adults. Here's my medical perspective for healthy individuals over 70. Focus your time, energy, and healthcare decisions on what truly supports long-term wellness. That means emphasizing movement, balanced nutrition, meaningful social connections, and thoughtful management of any existing conditions, rather than chasing potential problems through frequent, aggressive medical tests that may do more harm than good. This isn't about ignoring warning signs or refusing medical care altogether. It's about making informed, mindful choices that value quality of life over quantity of procedures. In fact, many studies show that after age 70, a gentler, more balanced approach to healthcare often leads to longer, healthier, and more comfortable lives than the test everything, treat everything mindset that has become so common. And before we finish, there's an important point for older adults who are taking charge of their well-being, those choosing to skip unnecessary tests, but still want to keep their bodies strong and resilient. Maintaining good health naturally means caring for the body's core systems, your heart, immune function, energy, and overall vitality. To help support these areas, some people turn to natural approaches that gently promote healthy aging. For instance, organic watermelon extract rich in natural L-citrulline can help support normal blood pressure, encourage healthy circulation, and contribute to overall cardiovascular wellness in a simple, natural way. For those seeking more complete support not just for heart health but also for energy, hormone balance, metabolism, and overall vitality, there are comprehensive formulas designed to nourish the body's natural strength. These often include ingredients like eccrine from horny goatweed for circulation and stamina, tongkat ali for hormonal balance, fenugreek for metabolic support and steady energy, nettle root for prostate and overall health, and concentrated L-citrulline for optimal cardiovascular function. Together, these nutrients can help the body stay strong and balanced, allowing you to feel confident in choosing a more natural path without relying on excessive medical testing or intervention. Ultimately, the key to healthy aging after 70 is learning to work times with your body, not against it, supporting its natural systems while avoiding the stress and complications that can come from overtesting. And of course, if any symptoms persist or concern you, always speak with a qualified healthcare professional for guidance. If you found these ideas helpful, feel free to stay tuned for more gentle, practical ways to support healthy aging naturally.